All right, let's get right into it. We're talking about a really big story that's developing right now, and it has to do with the cost of health insurance for millions and millions of Americans. So here's the big question. Is your health insurance bill about to shoot up in 2026? Well, for millions of people who get their coverage through the ACA marketplace, a huge price hike could be on the horizon. And it all hinges on a critical deadline at the end of 2025. Get a load of this number, 18%. That's the median proposed premium increase that insurers are asking for in 2026. To put that in perspective, it's the biggest jump we've seen since 2018. And if you look at why, they're pointing their fingers directly at the policy uncertainty coming out of Washington, D.C. So, okay, what is causing this potential sticker shock? Well, it all boils down to the expiration of some temporary financial help that has made insurance way more affordable for a record number of people over the last few years. You see, these beefed up subsidies really worked. They fueled this massive surge in enrollment. We're talking marketplace signups more than doubling since 2021. And this didn't just bring in more people, it brought in the right kind of people from an insurance perspective, younger, healthier folks. And that's absolutely crucial because their lower medical costs help balance out the pool, which helps keep premiums from spiraling upwards for everyone. Okay, to really get what's at stake here, what could be disappearing, we've got to do a quick breakdown of how these subsidies actually work. What's the difference between the old way and this temporary enhanced version? So back when the Affordable Care Act, or ACA, first started, it created something called premium tax credits. You'll see them called PTCs. The easiest way to think about them is like a discount coupon for your monthly insurance bill. The federal government pays part of your premium directly to the insurance company, so the bill you see is lower. Right. Then 2021 rolls around. We're in the middle of the pandemic, and Congress passes the American Rescue Plan. This created a much more generous, but temporary, version of those credits. We call them enhanced PTCs. The Inflation Reduction Act leader kicked that can down the road, extending them through 2025. And that's the deadline that's causing all this drama. And this is where you can really see the difference. The enhanced version did three huge things. First, it completely got rid of the income limit. This was a big deal because it eliminated what was known as the subsidy cliff, where if you earned just $1 too much, poof, all your help vanished. Second, it put a new ceiling on costs, saying nobody would have to pay more than 8.5% of their income for a benchmark plan. And maybe most importantly, for people with the lowest incomes, up to 150% of the poverty line, it made certain plans available for $0 a month. So you can see why this is a big deal. The really critical question now is what happens if this temporary help just goes away? The impact is going to be different for everyone, depending on your age, how much you make, where you live. But for some folks, the hit is going to be massive. Yeah, let's put some real faces to this. Let's meet John and Louise. They're a couple in their mid-50s living in a rural part of California, and their income puts them just over that old 400% poverty level cutoff. Because of their income, if these enhanced credits expire, they go right over that subsidy cliff we talked about. All their financial help disappears overnight. And look at this number. Their monthly premium would jump by $2,165 a month. That's not a typo. Suddenly, their health insurance would eat up a full third of their income. Just wow. Okay, that's an extreme example of the subsidy cliff. But what about a middle-income family? Let's take Carla's family of three, also in California. Now, they'd still get some help under the old rules, but it would be a lot less generous than what they have now. For them, the hit is an extra $249 a month. Now, that might not sound as shocking as $2,000, but think about it. For a family budget, that's a car payment. That's a lot of groceries. It would push the share of their income they spend on premiums from around 6% all the way up to 10%. That's a big squeeze. And I want to be clear, we are not talking about a small group of people. Look at this chart. A staggering 45% of everyone enrolled in the marketplace this year has an income low enough to qualify for those $0 premium plans. That's nearly 11 million people who could go from paying nothing to paying something. And for them, any increase is a huge deal. So if we step back and ask who gets hit the hardest by this, well, it's a few key groups. It's older adults, those in their 50s and early 60s with moderate incomes who fall off that subsidy cliff. It's individuals and families with the lowest incomes who might lose their $0 plans. It's small business owners and gig workers who rely on the marketplace. It's people in rural areas where premiums are already sky high. And it's Black and Latino consumers, groups that have seen some of the biggest gains in health coverage under these enhanced subsidies.
So, naturally, with a deadline like December 31st, 2025, staring everyone in the face, this has exploded into a major political fight in Congress. And it's gotten pretty dramatic, pretty fast. Let's just walk through what happened recently in the House. So, in early December, the Republican leadership puts forward a healthcare bill. But guess what's not in it? Any extension of these subsidies. So, some of the more moderate Republicans try to add an extension, but they get shut down in the Rules Committee. The bill passes without the extension. But then, on that very same day, 4 of those moderate Republicans do something pretty rare. They team up with Democrats to sign what's called a discharge petition. It's basically a procedural Hail Mary to force a vote on a clean 3-year extension, a vote that leadership was trying to prevent. And this quote from one of those Republicans, Brian Fitzpatrick, just says it all. He said, "The only thing worse than a clean extension would be expiration." I mean, what he's saying there is pretty clear. Even if you're not a fan of this policy, the political pain of letting it die and having millions of your voters see their insurance bills skyrocket, that's a whole lot worse. Okay, so the clock is ticking. We've got a political showdown on our hands. So what happens next? What are the real options here? As I see it, lawmakers have basically 4 paths they can go down. Path number 1, they do nothing. They just let the subsidies expire and everything snaps back to the old, less generous ACA rules. Path 2, they kick the can down the road, pass a short-term extension, maybe for 1 year, maybe 3, and deal with it again later. Path 3, they go all in and make the enhanced subsidies a permanent part of the law. And then there's Path 4, the compromise route. They could extend the subsidies, but maybe with some changes, like bringing back an income cap or asking low-income folks to pay a little something for their premium. And of course, none of these choices are easy or cheap. You can see the trade-offs right here. Making this permanent would add about $350 billion to the deficit over the next decade, but it would also keep almost 4 million more people insured. Even just a 1-year patch has a price tag of over $23 billion, so you're constantly weighing the cost against the coverage. And that really brings us to the fundamental question here, the core dilemma that lawmakers are wrestling with. It's this classic DC trade-off with no easy answer. On one hand, you have affordable health coverage for millions and millions of people. On the other, you have hundreds of billions of dollars in federal spending. Is there a middle ground? That's the question they have to answer, and the clock is ticking.